Alrighty. Hi, on behalf of ASCP, I'd like to welcome you all back to the Building Bridges Across the Laboratory Community series, which is being launched in collaboration with the CDC as part of the One Lab initiative. I am Allie Brown. I'm the Chief Medical Officer at ASCP. This series, it focuses on unique laboratory partnerships that impacted the laboratory workforce challenges or any public health emergency response efforts. We'd like to acknowledge that this resource was made possible by funding from the CDC. However, ASCP is solely responsible for its content, and the viewpoints shared do not necessarily represent those of CDC. On to you, Rodney.
Hello, everybody. My name is Rodney Rohde, and I will be co-moderating today's session. I am a Regents Professor and Chair at Texas State University, and I have a nice history with public health and the medical laboratory. So it's wonderful to be here with you guys today. Today's session will feature three fantastic case studies on the topic of supporting DEI initiatives in the laboratory workforce, followed by a Q&A session. We'll then wrap up the session with some reminders. ASCP will offer one CMLE credit for attending today's webinar. Credit claiming instructions will be provided in a follow-up email shared tomorrow via Zoom. Before we get started, I wanted to quickly share a few housekeeping notes. Lines will be muted, so please add all questions for the panelists into the Q&A chat box, and my co-facilitator and I will moderate questions at the end of the session. Closed captioning for this webinar is enabled for any interested parties. Additional resources, including a link to the recorded session, will be available around 2 weeks or so after the session on our website. We'd like to ask each speaker to briefly introduce themselves before starting their case study. And with that, we'll go ahead and pass it off to Dr. Baker to get started.
Thank you, Dr. Rohde. Greetings, everyone. It's an honor and a pleasure to be with you today to present on building bridges as that aligns with our work and partnerships and, of course, supporting DE&I initiatives, rather. And so I'm Dr. Dana Powell-Baker, a manager for academic partnerships with the Association of Public Health Laboratories. And so I just look forward to sharing our case with you today. And of course, any questions that you may have, feel free to add that to the Q&A section, and I'll be happy to address those toward the end of today's session. Next slide, please. And so I just want to start with an overview of who we are, just to make sure that everyone is just at least familiar with what we do with APHL. And so a lot of our work really does center around our focuses on strengthening our laboratory systems, serving the public's health in the United States and globally. Our organization represents state and local, as well as territorial governmental health laboratories throughout the country. And this includes public health, agricultural, environmental, and other related laboratories. For our members, collectively referred to as public health laboratories. Of course, we support their work in monitoring, detecting, and responding to global health threats. Next slide. And so as an organization, we do have our core values, which does include diversity, equity, and inclusion, as I wanted to call your attention to that being the first core value that is listed here, and where we collectively demonstrate a commitment to diversity, equity, and inclusion through our actions, relationships, and interactions. And this also does feed into the partnerships that we have with other like-minded organizations that prioritize diversity, equity, and inclusion. Next slide. And so what we do, as I am affiliated rather with our training and workforce development team, but within that we do have experiential learning. And so we work with or collaborate with the CDC in seeking students who are interested in exploring career pathways in public health laboratory science. And I'll go through our different program areas here a little bit shortly. But with that, we have our public health laboratory internship and fellowship program opportunities, in which we are also seeking degreed applicants who would like to start or further their career in public health laboratory science while working collaboratively with industry leaders, mentors, and developing those professional networks. Next slide. I think we hopped the slide. There we go. Thank you. And so as an APHL CDC initiative, we do have 4 program areas within the experiential learning area. And so I'll start with academic partnerships, to which I manage. But we are a new program area. This June will mark 2 years for this program area. And we really work to forge those collaborative relationships between public health laboratories and academic institutions in the promotion of our fellowship, internship, and leadership program opportunities. And then if we kind of follow this going clockwise, our internships program is also a newer initiative in which we promote this to current students who are actively enrolled or actively pursuing their certificate, associate, bachelor's, or master's degree, to help give them that opportunity to gain that foundational experience in public health laboratories. And within that internship opportunity, they do average about 20 hours per week, and that can be 12 to 16 weeks in terms of the duration of that internship. And then if we keep going clockwise, we'll touch on the leadership program. And this does include our emerging leader program as well as our laboratory leaders of today programs. And this does also focus on the alumni from those program areas as we work to develop and help to grow those future laboratory leaders. The boot camp program itself helps to prepare for the board exams, as we do have different exam preparations that are happening within that group. But this is required especially for our direct high complexity testing laboratories. And of course, there's so much more I could add for each program area, but I know my time is limited with you all today. Lastly, but of course not least, our fellowship program, which has been around for a number of years, in addition to the leadership program, but it has been reimagined or expanded for college graduates who are interested in careers in one of these following program areas. We have bioinformatics, biosafety, and biosecurity, emergency preparedness, infectious disease, informatics, food safety, newborn screening, and quality management. And so for today's case, I'm gonna focus more so on academic partnerships and internships for this study. Next slide. And so partnerships, again, really, we recognize that these are essential to help supporting our programs, in particular with our internships and fellowships programs. This is crucial to recruitment and retention efforts for the public health laboratory workforce. And in fostering those partnerships, again, we really focus on strengthening partnerships with other organizations, academic institutions who prioritize DEIA. And our program team, which is currently comprised of myself and 2 specialists, we really work to promote these opportunities through different outreach activities, including campus visits, career fairs, exhibit booths. I'll talk a little bit about our social media today. If you're not following at APHL, I encourage you to do so across all social media platforms, I feel like at this point, and also several speaking engagements such as the one I'm doing now. Next slide to kind of get more into our different program areas. So with internships, again, I know I explained that a little bit here, but just to expand on that, the requirements for our internship program does include a U.S. citizenship or permanent residency, as well as a completed online application. And you could do that through our website, which I'll share that link here a little bit later. We also ask for work history and a reference that could be either academic or professional, as well as your college transcripts. Benefits of this program does include that opportunity to network with other public health laboratory professionals, as well as gaining that firsthand experience in a public health laboratory. And you also earn a competitive stipend, as well as building those transferable skills. Next slide. And so I just wanted to call out one specific example that we had here, one of many success stories that we've had with our career pathways programs regarding internships. And so this actually happened about a year ago, to almost to the day, I almost feel like, where we were actually preparing for our leadership program to engage in a leadership activity in Nashville, Tennessee at the Public Health Laboratory there, in which on March 14th, a colleague of mine, Cherie, who works on the internship team, sent me an email and said, hey, we're going to be in Nashville for this leadership program event. And I noticed that there's a career fair coming up at Tennessee State University, which is a historically Black college and university, in which we thought would be a great opportunity to promote the public health laboratory internships as well as the fellowship program. And so she asked me to work my magic, hence the work your magic in quotations. If it is possible in that shortened time frame to make it happen, can I? And I said, absolutely, we will make it work. And so in those 10 days, as you see, between March 14th and March 24th, Not only did we just register for that career fair, but we also had to send communications to the faculty and staff with programs that we felt like really spoke to those qualifications for the internship program as well as our fellowship program. And so on March 24th, Cherie from the internship team and Shelby from our leadership program, just showing that collaboration across our program areas, represented our programs, not just at the Tennessee State University Career Fair, but also at another event that morning at Vanderbilt University with their medical laboratory science program. So of course, just bringing this information to the students, meeting them where they are. And thankfully, due to their outreach and engagement, when the actual application launch for the internship program on March 27th, we actually received, with one more click here, you'll see that we actually had our first internship application. Sorry, back to the previous slide. But we received our first internship application on March 28th, one day after that launch date. And our first application came from Tennessee State University. So just seeing the impact of just us working quickly and collaboratively together to make that happen and seeing the outcome of that outreach. Next slide. And so we were able to highlight a couple of our interns recently here in a program success story. So if you scan this QR code, it'll take you to our recent publication about their internship journey, how their mentors impacted their journey right there at Tennessee State Public Health Laboratory. And one of these individuals, actually Cameron there pictured at the bottom, just recently got hired into the Public Health Laboratory following the completion of his internship. So really highlighting the pathway that we hope to see by exposing students to these career paths. Next slide. And so again, there's different ways that we do promote these opportunities through our career fair announcements, through our various social media platforms. We also have an academic partnerships newsletter that our team works on to highlight these opportunities and to include these success stories about interns and fellows, as well as the articles that we include in Lab Matters to really focus on how we foster these partnerships and relationships between academic institutions and our public health laboratories, but also just really having that intention of increasing the diversity of our workforce through our outreach efforts. Next slide. And so kind of a reward of that work, not just that one instance, but several other success stories that have occurred. We were recently recognized in September 2023 by Insight into Diversity magazine, being one of the inspiring programs in STEM, and just really recognizing our work and not just increasing the awareness of these opportunities, but our intention of increasing a diverse pathway or diverse pipeline into our pathway programs. And so that's been really exciting to celebrate and just to continue our work in that area. Next slide. And so quickly, lessons learned. We found that just through that opportunity and others, that's really important to share the vision. It's not one that could just stay within the academic partnerships program, but with the teams that we collaborate with our internship, leadership, and fellowship program areas. It was really important to establish an outreach strategy. So not just saying that we're just going to communicate these opportunities with everyone, but really being intentional and that we are reaching out to minority serving institutions, especially our historically Black colleges and universities, Hispanic serving institutions, tribal colleges and universities, onward and so forth. Also, while we're doing that outreach, we want to be mindful in employing those best practices with effective communication and teamwork, not just amongst ourselves, but also with our partners in the public health laboratories, because a lot of these events, they will join us on in that outreach. Also seizing the opportunity, as my colleague Cherie did. I know she's surprised that I probably called her out a lot in this, but I think it's really important to celebrate that, just recognize an opportunity to promote our opportunities and to bring other people into the fold. And then also seeking opportunities for professional development. We do a lot of work behind the scenes just to ensure our cultural competency and cultural sensitivity when we are reaching out to these diverse groups. And what's not listed here is not assuming that people know about these opportunities, especially our students and our faculty. We want to make sure that we're increasing the awareness and the visibility of these internship and fellowship programs, and of course, encouraging their students to apply. And with that, my next slide. This is our contact information for our program areas. Please feel free to reach out, and you can scan this QR code just to learn more about our different programs through our website. And with that, I thank you. I think that's the next slide. Thank you so much for your time. And now I will respectfully transition over to the next speaker.
Hello, everybody. My name is Cliff Sullivan. I am a laboratory director at Emory University in Atlanta, Georgia, and I serve as the chair of the workforce work group within the DI committee of ASCP. So I'd like to thank the organizers for granting me this time to share with you guys what we've been up to within the DI Council. Next slide. So we'll just start off with our mission that we created in 2020 when we initiated the committee. We want to foster a diverse and inclusive pathology and lab medicine field that is a place where everyone can thrive. We want to promote leadership, awareness, and mentorship for an enriching and supportive environment. And we really ultimately want to try to help labs mirror their communities. Next slide. So the way our committee is structured is we currently have 3 work groups. One that focuses on initiative, another one on workforce, and one on Indigenous health. And each of these working groups is tasked with brainstorming and formulating different initiatives. We actually just earlier this year, we're trying to come up with our initiatives for this year. We then go to the committee at large, propose our ideas before they can move along the chain of command within the organization. Next slide. So where do we start? How do we start? Our initial efforts were really to assess our membership demographics to identify gaps and needs. And what we found was that representation for minority groups, both within the pathology section and the laboratory professional sector of our organization was lower than in the general population. And we also found that women held fewer than 20% of our leadership positions within the organization. Next slide, please. So with these data, we really identified our 2 key audiences to target our efforts on, and it led us to ask two main questions. Why does our membership not mirror the community at large, and why are women underrepresented not only within our leadership positions, but leadership positions in general in healthcare? And so in order to tackle these issues, we've kind of formulated and outlined 5 main strategies, which we'll go through each one next. So next slide, please. So we'll start with awareness. We really want to bring awareness about pathology and laboratory medicine so we can attract all types and diverse individuals to the field. We already had a really good network. We have our career and pathology ambassadors who are out there in the field trying to promote pathology. And so we really leveraged them to reach out to different high schools, even middle schools. We do STEM fairs. We visit medical students. There's great Nexpo event in which we reach out and we expose students not to didactic kind of informational sessions, but also hands-on kind of lab activities to get them excited about lab medicine. We also celebrate diversity through our Heritage Months. We created a DEI diversity calendar that we highlight different members of our organization each month. We offer scholarships. There's the Ring Scholarship, the Laboratory Student Scholarship, and really reaching out to underrepresented minority students. We're really excited about the inaugural DEI award that will launch this spring, where we're going to recognize an individual who's promoting diversity, equity, and inclusion across mentorship, education, training, and/or workplaces. Next slide, please. So now I want to spend some time on strategy number 2, which is our collaboration and partnerships, given that effective utilization and partnerships and the collaboration therein is the focus of this webinar series. So on this slide, I have a bunch of our different partners that we've engaged to really drive impactful DEI initiatives within our field and beyond our field. So some of these, all of these, initiatives are pretty diverse. We have partnerships from establishing MOUs with organizations like the Society of Black Pathologists. We also are creating educational lab content for laboratory visibility with Lab Drawer. We're also working with the Clinton Global Initiative and Center for Health Workforce Studies to really strengthen diversity within the laboratory workforce and increasing both, hopefully, recruitment and retention within our field. We also work with organizations like the AUBB, the National Kidney Foundation, and ASH, or American Society for Hematology, on laboratory tests, database building, as well as reference range reform, with the ultimate goal to drive, being driven by the desire for higher accuracy in testing for our diverse patient populations. And finally, just to highlight, AACP is participating with the ACGME in their Equity Matters Continuous Learning and Practice Improvement Initiative to focus on increasing healthcare workforce disparities, as well as inclusive learning environments and addressing other healthcare addressing workforce diversity. So next slide, please. We also are focusing our strategy on mentorship to nurture and advance young professionals in their career and offering opportunities, supporting them, helping with their educational and professional development. We've built a program specifically for underrepresented minorities to provide guidance and support along their academic journey or within their careers as laboratory professionals. Next slide, please. And then as for education, we're really trying to create educational content to enhance, what DEI is, understanding and the knowledge of it. We have developed a wide range of in-person and virtual events, including courses, town halls, and podcasts. Our annual meeting now has dedicated sessions to healthcare equity. We also have quite a few in-house journals and membership magazines that were featuring articles and editorials on DEI and its principles and events. And then we're trying to ensure diverse perspectives as well by ensuring that we include faculty from underrepresented groups in our programs, as well as in the publications that we feature. Next slide, please. And our final strategy, our fifth strategy, is changing the DNA of AACP, so to speak. So we want to try to affect change at all levels. We're being really proactive to embed DEI principles across our education initiatives by the creation of a DEI CIRSEC. The CIRSEC is our Curriculum Educational Resource and Scientific Advisory Committee. We've also revamped our volunteer application processes to promote equity in our committee selection. Furthermore, we've enhanced DEI representation across the organization within different committees and even up to our board of directors. And then we finally have enabled and encouraging members, AACP members, to suggest positions and ideas to the Commission on Science, Technology, and Policy to foster inclusivity and further engagement. Next slide. And then we have our lessons learned. So what have we learned thus far? So it's really important to have the support of our organization, especially high up, and to ensure that we have effective resource allocation. And we are monitoring our progress. We really want to leverage, what has been published out there to show the benefits of diversity, the profitability of diversity. We also found it helpful to implement this divide and conquer technique where, where we have our different work groups within our DI committee, brainstorm ideas and focus on various different facets of DEI. We're also being very adaptable. So I can tell you back in 2020, when the DEI committee first was formed, it looked a lot different. That there were different work groups. So now we've been adaptable. We try to refine our structure in order to meet our needs, or what do we notice now that we really need. And I'm sure that in the future, the three working groups we have now might not be the three working groups that we have in the future. Maybe we'll have more. And then we're trying to walk the talk. We want to put our actions over our words. We want to integrate all DI principles across the organization, and we really want to evaluate the changes that we're implementing to show their benefit and hopefully inspire ongoing support within our initiatives and for our committee. So with that, next slide. I would like to thank you for your time. I'm looking forward to a lively Q&A section. Please upload your questions and comments, and we'll talk to you later. And I'll yield the speaker. Thank you.
Great, thank you. I am Dr. Marilyn Bibbs Freeman. I am the Deputy Director for the Division of Consolidated Laboratory Services in Virginia, which is Virginia State's Public Health Laboratory. What a great topic for today, and what great presenters we've had so far, because one thing I do know about building bridges is that it can't happen alone. And our two previous speakers have done a wonderful job of showing that and demonstrating that in the work that they're doing. So I'm going to just take a little bit of time to talk about the Diversity, Equity, Inclusion, and Accessibility Committee at APHL. I am very grateful and very thankful to be able to live out a passion with this particular work group. So around August 2020, a group of individuals interested in this particular topic got together very informally to discuss the needs of APHL membership around the topic of diversity, equity, inclusion, and accessibility. And, it was pretty much made up at that time of just APHL members who were seeking to eventually get to or extend our services and resources to are both internal and external partners. Those internal partners obviously are our APHL membership community, but also our APHL staff who attend our presentations as well. I will also say that our APHL community is very expansive. And so it's not just public health laboratories, there may be health departments, hospitals. Lots of people seek the services of APHL for various reasons. But ultimately, we want to enhance the experience of laboratory science for the communities that we serve. Are we equitably servicing them is a question that we want to ask ourselves. Are they getting what they need from us? Do they know who we are? And so why was this particular committee formed? And well, I will say at the time, the president of APHL had a vision that there was a gap in DEIA amongst the membership. And that was really the starting factor. But I will say at that time, there was obviously the COVID-19 pandemic, and it created this inequitable, what I call trifecta. And it was the SARS-CoV-2 epidemic, increasing advocacy for racial justice, and then also a financial crisis, all occurring at the same time. And so all of these things kind of created the perfect storm to say, you know what, this is an opportunity during a time of turmoil that we can use to push forward the paradigm of DEIA. And so we've transitioned from being a very informal task force to being a more organized committee. And with that organization came the creation of a charge statement and the things that we felt were most important. In addition to that, our goals being attainable and specific and measurable, and things that were going to be really helpful to the community as a whole, both internally and externally. Next slide. So our high level vision, we initially thought was to make an external impact on the communities that we serve. And we quickly realized that we actually needed to do some internal work with our own membership before we could effectively push the things that, or the opportunities that we have available and the services we have available externally to our customers. And so from a high level vision standpoint, our goal was to always first build knowledge, and that knowledge comes internally and externally from collaboration amongst interested parties, but sometimes also seeking people who have more expertise and more knowledge than us externally to enhance what we know and what we understand. The next part of that vision is to begin to understand. Once we know, we need to understand what is going on, how we can be effective, how we can push forward the paradigm of DEIA in all settings and for everyone. And then finally, ultimately, we want to move to practice. How do we apply what we now know and understand to the benefit of everyone? We want to become a more strong workforce, but also a stronger system that can provide quality services in an equitable and culturally competent manner to the people that we provide services to. So we've become very intentional about the work that we do with the DEIA committee, and we encourage that same level of intentionality among others. Next slide, please. So this should come as no surprise. I'm pretty sure that people who are really into work processes and improving them are very familiar with plan, do, study, act. And that is really what we have done in our high-level vision from moving from knowledge to practice. We have used this particular process improvement strategy. In planning, we are seeking input from our partners. We are seeking input from our committee. We are seeking input for people who just want to give us information. We look at current events. And one of the biggest things that we do in our monthly meeting is we voice our opinions, concerns, and observations related to key events that are occurring in the real world. And one of the reasons we do that is for us to be able to be good advocates for ourselves and for others in our system. We have to be able to speak intelligently about the things that are going on in a way that is consumable to everyone. And so I know we live in a society where everyone should be able to say what they want whenever they want, but the realistic point of view is that if you want people to hear what you are saying, you have to be able to give that information in a way that they are ready to consume and interpret. So we do a lot of planning in our monthly meetings and a lot of conversation in our monthly meetings about where we go next. The next thing we do is we act out what we've planned. We do it and we look to see how it goes over. What we are trying to make sure we do is always have some level of forward movement. Always forward is something that we always say. Low-hanging fruit is amazing. And so what you'll see in the rest of this presentation is that while we see collaborations with big partnerships and very solid partnerships, we are also looking at smaller collaborations individually from person to person, group to group, committee to committee, and also these bigger partnerships that allow us to always move forward. It doesn't have to be perfect. It just has to be powerful. Once we've done, presented a presentation, given a webinar, asked for feedback, we look to see if it was effective or not. What kind of information and feedback did we receive to say, yes, we're on the right track, or no, we aren't? And if we have that information, we make a decision during the act part of this implementation to determine whether this is something we will do again, or whether we do it again with amendments, or whether we just drop it and don't do it at all. So next slide, please. So in our planning, I'd like to highlight initial brainstorming as a collaborative activity. We look for members who are interested in the topic. We again look for our partners that may have said something to us. We have created a forum called APHL Gathering Place, All Are Welcome, where people are free to post their opinions, their comments about any topic related to DEIA. Also to give news, to ask questions, and to ask for help. We were able to capitalize on the power of the Quality Systems and Analytics group at APHL to put out a DEIA survey as part of the workforce survey. They gave us some really interesting information on where our gaps may exist and things that we need to target. So again, collaboration outside of our specific skill set and with another work group with APHL. Then we begin to offer book clubs to all member laboratories with engagement ranging from a handful of people to well over 50 at times. We have done webinars, we have invited guests to speak on topics of interest such as immigration laws, DEI 101, and then handling challenging situations. Gathering Place, as I previously mentioned, is a collaborative community where all members can engage on topics related to DEIA in a respectful way and can be guaranteed that if they're seeking a response to that information, we will do our best to get that information to you. Next slide, please. So some of the collaborative activities, there were honestly just too many to name. So I decided to choose from some of our more powerful activities that we have done. With the Workforce Development Committee, we had a session on affinity groups, as well as future work with this particular committee on safe spaces is currently underway. How do we create spaces that people feel comfortable working in, but also how do we ensure that our cultural competence shines through to our customers as well? We had a session with the Environmental Health Committee on hiring and recruitment and how to make those fair processes and equitable processes such that we have diverse candidates interviewing and having the same chance of being selected for a position as anyone else in that particular applicant pool. We did work with the Public Health Laboratory Training Center as well. Here we discussed how to create a DEIA strategic plan and how these can be applied in practice when you are training individuals in a public health laboratory. And then finally, one of the other things that we are most proud of is the Emerging Leader Cohort, where we partnered with one of the cohorts to help create toolkits and other resources related to diversity, equity, inclusion, and accessibility. Next slide, please. So here is some of the feedback that we have received, kind of set up as strengths and opportunities. We've heard, I am so glad that APHL created a space to have these conversations. We have also heard, I appreciate the way you address tough topics with kindness. Or this was a great book when we've selected a book that was instrumental in changing the way that people think about DEIA. And then one last person said, I want to help create culture-based resource groups at my employer, at my particular place of employment. There are unfortunately also some opportunities, but we're trying to look at that in a positive manner. We have had naysayers say that APHL needs to focus less on DEI and more on the real work of public health. People ignore me because of my accent. I was passed over for a promotion, and I think it has something to do with my race, or I want to have these conversations, but I don't know how. And the main reason I list these opportunities in here is to be very realistic that it's not going to be all roses and sunshine all the time when you are doing the work of DEIA in this particular space, but that is okay because the wins far exceed the opportunities and the negative feedback that we received along the way. Next slide, please. So some aspirational goals that we are hoping to implement in the future that are also collaborative are instructor-led trainings, affinity groups, partnering with other APHL committees, hopefully evaluating public health policy and practice, instituting office hours for DEIA, creating accessible workplace evaluations, and finally toolkits that are based upon the needs and the feedback that we've received from our audience at large. Next slide, please. So final tips for success for the DEIA committee have been to be genuine, to be consistent, to be prepared, always listen, always be flexible, always move forward, and recognize that giving up is never an option. So thank you for your time today.
Excellent. Thank you all so much for those fantastic presentations. We will now be able to open up our discussion here for any sort of Q&A. And we do already have some questions typed into the Q&A box. So for all the participants, if you have any questions, please go ahead and submit them. The first question is whether any of you offer practicum opportunities for MPH and not an internship.
Sure, I can speak to that. So in terms of practicum, which can also be referred to as an internship, just depending on the need for that particular practicum. Is there a certain minimum of hours, a minimum number of weeks? What is there material that must be covered as a part of that experience? Those are all details that we love to learn from programs as we are looking to if this is a good fit for their learner or not, especially when it comes to meeting a course practicum requirement. And so I will share that if you have those kind of questions and you want to meet with our programs individually, whether that's with academic partnerships, myself, or with the internships program, we have those kind of calls all the time. And so we're always happy to host those kind of virtual meetings just to kind of explore what your practicum looks like for your learners and to see if this internship program or our fellowship program, for that matter, may be a more suitable fit. I will share that we are open to various majors applying. We do have several MPH majors that do apply for these opportunities. And so again, maybe that just requires a one-on-one discussion. And that's where I would encourage you reaching out to us via email. And I could drop my email in the chat again here if you'd like to set up an individual call, and our team can come together to meet with you just to identify what the needs are of that practicum and to see, again, if which one of the two or both would be a great fit for your learners.
To expand on that, Dana, Dr. Baker, people are interested in a little bit more description about the internship. What are the hours? What is the location? And then, application requirements. Can you apply if you don't have prior experience? And how does one apply?
Absolutely. So our internships are offered literally across the country. We aim to place our interns within the same geographical region of where they may currently go to school or where they reside. So as an example, I'm an Atlanta native, so I always want to go back to Atlanta with an example. But let's say if we have a student that's at Emory University that is actively enrolled in school and they apply for an internship, we would not place them in a lab in Tennessee, for example, but we would rather place them at the public health laboratory that is located there in Atlanta. The hours, again, that's going to be typically Monday through Friday during the day. We don't offer evening or overnight internships, as we do adhere to the hours of that public health laboratory. On average, as mentioned earlier in the presentation, most of our interns may complete up to 20 hours. We have some that may do a little less per week, some that may do a little bit more, just depends on their course load. And of course, meeting that what agreed upon number of hours between not just the intern, but also the host laboratory. And so that's all a part of that interview process and discussion when we are matching interns to that respective public health lab. And then I forgot the third part of your question. Dr.
I think, what are the requirements for someone to apply?
Sure. So again, we can go back to that slide, or it's also on our website as well, but that requirement of U.S. citizenship or permanent resident, that they've completed at least one semester, their first semester of school, that they are still actively enrolled in school, and they could be pursuing a degree, whether it's an associate's, a bachelor's, or a master's degree. And if they have more questions about that, I can add that link to the chat as well for the internships and that whole list of eligibility criteria there.
How about specifically like what type of degrees they're pursuing? Does that matter?
Open to all majors for internships.
Awesome.
Yeah.
Gonna get-
It's intended to expose students who never probably worked in or seen or even toured a public health laboratory. It's all intended to increase that exposure and to build that foundational skill set.
Excellent. We have another question that's a little bit more broad, just about DEI. Someone is curious if those with health conditions are included or relate to the DEI inclusion principles, and if so, what opportunities does that give leadership in the field?
I can try to take a stab, if you want. I mean, for sure, people with health conditions should be included in DI, initiatives and principles. Something that comes to mind, just again, what we're up to at AACP is that we're trying, as I said, we're trying to integrate DI across the board in all programs. One program is the Patient Champions. Patient Champions highlights patients with all sorts of health conditions. And we highlight not only them, but the role of the laboratory and how the laboratory helped them through their journey, diagnostic journey, as well as their healthcare their management of their condition. And we really do, when we select these patient champions, who we end up, inviting them to our annual meetings. We have interviews with them. They make a video to post on our website. We really not only keep in mind the diversity of the different conditions that we're looking at, but also the people that are representing those conditions. But another facet, I guess, by including what I get, the second part of the part is what opportunities does that give leadership? Well, I really think including everybody with any sort of health condition is just another facet of DEI, but you open up your possibilities of who you're going to help. So think about people with access issues, accessibility. You could really help include and provide support and support for different types of people. And I think that in of itself gives the leadership some direction in which to implement their initiatives. I guess that's what I got.
It's good stuff. Thank you. Anybody else want to speak to this question?
Hi, this is Marilyn. I just actually dropped a response in the chat to this particular question, and I'll answer it here as well. Of course, people with all different types of abilities should be considered within the system that you work. And so I think there's an opportunity for leadership to be very intentional about the policies and procedures that we put in place, and to demonstrate, as Cliff kind of said, to walk the talk, that we know that we have a pretty much a cultural diversity within every workplace that should feel comfortable working within the space that they're employed. And so absolutely different people with different abilities should be considered for any type of initiative that may take place in your particular laboratory or workplace. And leadership has to be very intentional about that.
Thank you for speaking about that. The predominant questions, Dr. Baker, I have to say, still, people are super interested in this opportunity. I think we have a lot of people who are joining our webinar from maybe other countries or other parts of the world. I know you mentioned about being some requirements around being a U.S. citizen or a permanent resident. Did you want to reiterate those?
Sure. So for both our public health laboratory internship and fellowship opportunities, it does require U.S. citizenship or permanent residency. But I will add that we do have job vacancies across public health laboratories across the country. And so that doesn't necessarily exclude someone from directly applying to those types of job postings or positions. So APHL does have a job board, or job center rather, on our website. And so you can always access that to see what current opportunities do exist for that direct application to those vacancies. And of course, reviewing each of those for their own requirements when it comes to hiring for those positions. But yes, but at this time, both the fellowship and internship opportunity is more or less limited to those who do currently hold their U.S. citizenship.
Sounds like there's a big desire for our international friends as well and colleagues. So maybe in
Yes.
the future, but yeah, currently for all those that are asking, those are the parameters. We're also having people talking about, this is such a great idea, but perhaps like one commenter lives in Florida and doesn't have those types of opportunities, perhaps, or is inquiring about them. And if I remember correctly, Dr. Baker, you talked about you're pairing people in public health labs, across the country. There has to be just a place that's perhaps near them.
Right. And with our fellowship program, I didn't get an opportunity to really expand on that in our case study, but the fellowship program does offer relocation assistance. And so for our fellows, because it is a 1-year fellowship with the option to extend to a 2nd year, there is that relocation opportunity if there's not a public health laboratory or an opening near where you are. And so I did want to add that aspect too.
Excellent. Dr. Rohde, do you have any questions?
Yeah, kind of actually a comment just on the conversation, and maybe a question. So for those of you who don't know, I'm an MLS program, a medical laboratory science program chair, but I had a background in public health before I kind of hybridized my career. One of the things I'd like to mention to everybody on the webinar is that you cannot do enough of letting students know, letting your communities know about these positions, these amazing opportunities that sometimes I'm 30 years in and I still am surprised that students are workers, ongoing workers don't realize of these amazing opportunities within ASCP, within APHL, and within other organizations. So you really can't assume, to Dana's point and other people's points, that your community knows about these. So please continue to help us amplify this message. And then kind of a question comment, kind of for Dana, but maybe just the team. Has anyone ever thought about like someone in an MLS program like me? Have there been partnerships where we're hybridizing the opportunity for MLS and say microbiology majors that are across the street from me in a different college to do public health laboratory or other types of internships? Do those exist? And can I, as a program director, kind of reach out and think about that? Because we obviously have the Department of Health in Austin, and there may be others in the state of Texas. So I'm just kind of curious. I don't know if I've ever asked that question.
Dr. Bibbs Freeman has a perfect example.
So I can't say whether this is commonplace or not, Dr. Rohde, but I will say that here in Virginia at the Public Health Laboratory, we have established a partnership with Virginia Commonwealth University's Medical Laboratory Sciences program. We actually created a master's level certificate program for people who have already obtained their ASCP certification or other certification for the clinical lab. If they want to actually do this master's program, they can actually go to this program that's being taught by our professionals here at the laboratory, then come here to do a public health practicum, which is really going to teach them things that are kind of outside of the purview of the clinical lab. They'll get exposure to bioterrorism and things like that here at DCLS. And so what we are hoping is that if people do this master's level program, that will give them the additional experience and education that they need to be technical supervisors coming out of the clinical lab program and then doing the practicum here as well. So they'll have their 2 years with a master's that they could come into our particular setting and work and be successful. Again, I don't know if that's a commonplace throughout the country, but I did want to share that experience here in Virginia.
Okay, yeah, that makes sense. And we'll talk more later. Those types of initiatives are interesting to me for sure.
We do have a question about how to apply for the master's program.
The master's program at BCU is actually run through the School of Allied Health Professions. And so their application process should be there. It's called a categorical master's in public health. It's a specialized certification, not certification, specialized program specifically for public health. So you should be able to find it on their website. We have 4 students currently enrolled. We're hoping to expand that in the upcoming year. It was brand new this year, this particular educational year.
We also have some questions about how people can get information about the program because they may want to develop their own program.
So I see that my boss is on the phone, is on the call, and I'm going to be really honest, this was her brainchild. I don't know if it's possible for her to come off of mute a little bit to talk about the program at all.
I don't know. Now you're talking technical.
Hey, Denise, we can definitely get information. If we can get that caller's contact information, we can get information to them about the process that we went through in order to establish this. It was a couple of years in the making, I will say. By the time the school got the appropriate approvals to actually have this particular categorical master's program at the school and be accredited for it, that took the most time, but creating the curriculum and the practicum has taken less time.
Sure. And I do see that Ace put something in the chat. So in the webinar chat, there is a link. So maybe some more information there and then contact information. So.
And I believe we're also going to be featuring this training program in a subsequent Building Bridges webinar, the one on training and fellowship. So more to come there. I think it's in the April session, but yes. So
Thank you,
hopefully we'll be able to answer more questions to come.
And that, folks, is what we call a teaser. So tune back in for that one. Unfortunately, it's time for us to wrap up this session, but we do have a few upcoming opportunities and events we'd like to share with you as we wrap up. Our next webinar will be on April 24th, featuring 3 case studies on partnerships supporting laboratory training and fellowships, including talks from the VA Public Health Laboratory, the University of Nebraska's MLS program, and CDC One Lab. Of relevance of today's session, ASCP is really happy to announce that we have a new DEI-focused laboratory workforce scholarship. This is called the Dr. Alvin Ring Empowerment Scholarship for Laboratory Professionals, which is made possible by a very generous donation from retired pathologist Dr. Alvin Ring. This scholarship is available to candidates from underrepresented groups and underserved areas who are looking to pursue higher education or specialization in the medical laboratory sciences. What a great opportunity. And we'd love to have the lab community support in getting this opportunity out to those who may need it and are eligible. For more information, check out our website at supportcdconelab.org.
Yeah, what a fantastic opportunity. So please share that with your colleagues. The annual One Lab Summit is also coming up in a few weeks, and it's open to all members of the lab community, especially lab educators and trainers. This virtual meeting will focus on the lab workforce theme of Thrive, People, Planning, and Preparedness, and will feature a number of outstanding workforce advocates. The agenda for the meeting is now live, and we encourage everyone to check it out and register for the meeting. Finally, we'll be offering 1 CMLE credit for this webinar. Again, instructions will be emailed to attendees tomorrow via Zoom. Credit can only be obtained and claimed by live attendees within 1 month of the webinar date, so keep that in mind. And with that, we'd like to thank you all for coming to today's webinar and encourage you to visit our site where you'll find more information on all of these opportunities at supportcdconelab.org. Thank you guys, and we look forward to seeing you at our next event.
Thank you.